So hello and assalamu alaikum. So this is a absolutely fantastic episode about how we are going to correlate 2D X-rays and how our AI software analyzes those 2D X-rays, and then we're going to compare those results with the gold standard three-dimensional CBCT. So the OPG will be analyzed by the AI, the CBCT will be analyzed by me, and we're going to actually check and verify if the AI software actually found all the pathologies and if they were accurate enough that the 3D also got it. So without any further delay, let's start with this particular X-ray. You can see it right here on your screen. We're going to put it on the AI software. The AI software is now analyzing the results. It's just fantastic. You can see how the results are being verified. This is the periodontal charting. We've got the inferior alveolar nerve, and then we've got all these pathologies and problems that the AI has found. Now we're going to go ahead and verify these things because that's something that a dentomaxillofacial radiologist has to verify. We've got decay in the upper right 8. We've got a sinus problem in the upper left 6. Then we've got decay in the upper left 8. We've got it says a right angle cyst. So we'll actually have a look at what this is on the CBCT. It talks about calculus. It talks about all these problems of decay in the lower right area. This is the periodontal analysis. This is something that the AI does as well without any problems. And then this is how the report is made for us and our patients. So we'll keep the data out. This is what we see, decay. And now we're going to go to the CBCT, which is right here, and now we're going to try to verify each and every problem that's right there. So 1 point for our wonderful AI, which has found upper right molar and its decay. The lower right, the AI shows us that the lower right is very close to the inferior alveolar nerve. Let's see what this guy shows us. So on the three-dimensional X-ray, we can actually see that the minimum distance between the two is actually, we still have 3 to 4 millimeters. So that's something that the AI, but again, that's the difference between a 2D versus 3D, that we feel like it's close proximity, but the 3D actually tells us how close it really is. Now quickly moving on to the next part, and that is decay in the lower right 7. For 7, and that is something that our CBCT is going to confirm, and they are absolutely spot on. We've got decay in the lower right 7, and you can see that here. So another absolutely correct diagnosis by our AI. Now moving to the upper, we've got this right here. There is decay in the 4-6 as well. Let's check this out here. If the 4-6 shows any signs of decay, and there you go, ladies and gentlemen, we've got decay in the 4-6 right there, quite significant, and that's again another win for the AI. Now we'll move on to the third problem, and that is right here. So periapical radiolucency in the upper left 6, very close to the sinus. Let's take you to the upper left 6, and there you go on the transaxial view, which is the true cross section. And here this is where we actually catch on, and there is no periapical radiolucency. The reason why the AI actually thought there was a radiolucency was actually this point right here, and this reason why we thought is because of this particular thing that we see right here. It's just an anatomical landmark from the palate, and hence it is not a radiolucency. So the upper left 6 does not have a radiolucency. We're going to cancel that and remove it from the nerve. The upper left 8 shows signs of decay, and let's go back to the 8, and then we'll see if this 8 actually shows signs of decay. And there we go, ladies and gentlemen, absolutely spot on. At the upper left 8 shows signs of decay, and you can actually see that in right here. That's there, we've got decay there, and then we see a little bit of decay in the distal aspect of the tool, but involving the dentine as well. So quite significant decay there. So that's again another correct diagnosis. The lower left 8 shows decay, the lower left 7 shows decay, and the lower left 8 is proximity to the nerve. And then we'll see that on the CBCT how the lower left 8 is doing. The lower left 8 again not as proximal to the nerve. The 2D might be deceiving, but the 3D shows us that the proximity to the nerve is not as significant. Then we do have decay in the 8. You can see that on this view right here, significant decay there. And then moving to the 7, again we see decay in the 7. That's also correct. That's what the AI detected here in the 7. And the last thing is this cystic lesion or radiopacity at the angle of the mandible. Let's find out what that is on the CBCT. There we go. So we're looking at a radiolucency or radiopacity, my apologies, on the angle, and then we can see nothing significant. So at the angle right here on this view. There you go. So this is the angle of the mandible, and going from all the way back to the anterior region, nothing significant in the angle of the mandible. So cystic lesion at the angle of the mandible is incorrect. We don't see anything there, and that's where we will go in and tell the AI that this is just an artifact. So even though this had a approximately 98% correct, it only had 2 areas or 3 areas where the report was not as accurate as we would have expected it to be. But the good thing is, specifically speaking, the AI detected 4 absolutely specific things which the AI thought it was completely correct about, and those were, apologies, and those were the 4 specific things that the AI thought it had seen were these guys. So just these 4 things which were very specific. The proximity to the 8, the decay in the 3-7, the decay in the 4-6, and the 4-8. So this is where the AI thought it was absolutely correct. This, and this. So these were the 3 things that the AI was absolutely correct about. Then it had optimal best results were including the 2 above, the decay in the 3-8 and the decay in the 4-7. Those were also very, and then these were the low confidence ones, the 11, the things that we showed you. So even the AI itself was not absolutely sure about the 3-4 things we talked about, and it also showed that it had low confidence levels. So overall speaking, I wanted the audience to understand and to correlate how AI is absolutely revolutionizing dental OPGs and how it's helping doctors diagnose better, how we are trying at Ultrascan to correlate that information and make sure how valid that information is. You can't trust everything 100%, but when you correlate 2D with 3D, it actually helps you as doctors to understand and to diagnose better, to better treatment planning, and to giving your patients the best. The last note that I will have for the audience today is that CBCTs will always be the gold standard when you're doing your treatment planning. Please make this a part of your treatment planning modality so that it helps you identify things and it helps you gain insight and it helps you plan better. However, if you just want to stick to OPGs, our AI software is approximately 98 to 97% accurate and can help give you that extra knowledge for what you need for your treatment planning.